Good morning. Welcome to the Health and Wellbeing Board, to this virtual meeting of September for the BCP Health and Wellbeing Board. Welcome to our partners who are joining us via the powers of the internet, and press and members of the public who may be viewing us on the live stream of the meeting. I will first of all ask our Democratic Services Officer to set out the housekeeping arrangements for those people who don't know how we do things at the moment in this virtual world. So, Karen, can I pass across to you, please?
Thank you, Chairman. Please note that this meeting of the board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everyone present follow these ground rules for speaking. Only speak when invited to by the Chairman. State your name before you speak if you've not been introduced by name. Some people may need to dial into the meeting and will therefore not have the benefit of the visual. Mute your microphone when you are not talking. If you would like to speak, please type RTS request to speak in the instant message conversation panel on the left-hand side of your screen and click the arrow button to send. Please note the panel is visible to all parties. If you are able to, it may be helpful to indicate the particular issue you wish to speak on in order to try to maintain the flow of the meeting. If there are any recommendations moved that require a formal vote, this will be carried out by the Chairman, asking for a response of for or against or abstain from each member of the board. Finally, please ensure background noise is kept to a minimum as far as possible, and mobile phones and other devices are turned off or switched to the silent setting for the duration of the meeting. Thank you, Chairman.
Thank you for that, Karen. So I'll move on just to make a couple of welcomes. So for those people that don't know me, I'm Councillor Vicky Slade, leader of BCP Council, currently chairing the meeting. This is our first meeting of the new civic year, so we will be going on to elect chair and vice chair shortly. But before we do that, I'd like to welcome Elaine Redding, who is our interim corporate director for Children's Services. This is the first of her meetings, the first attendance at our board meeting, and also Jenny Douglas Todd, who's the chair of the ICS, who's attending the meeting as an observer. They will both be invited to speak if they wish to, using the same system as other attendees. So the agenda item 1 is apologies for absence. Can I just ask whether there are any official apologies received for the meeting?
Chairman, it is Karen Tompkins. If you're happy for me to announce apologies, yes, I'll just run through them. We have apologies from Graham Farrant, Debbie Fleming, Eugenia Felle, David Richardson, Louise Bate, Karen Loftus. I'm hoping that I've not missed any apologies. Can I just advise that in relation to apologies from Debbie Fleming and Eugenia Felle, Richard Renault is here as Debbie's substitute, and Jane Elson was invited as Eugene's substitute. I'm hoping that I've covered all of the apologies, Chairman.
Thank you. So just for the purposes of the public that may be watching, Graham Farrant is the Chief Executive of the Council, and Louise Bates is Health Watch, David Richardson is the representative of the Clinical Commissioning Group, and Karen Loftus is our voluntary sector representative. The other two, Debbie and Eugene, are from the hospital and the community health services, so they should hopefully have substitutes on their way.
Chairman, can I just confirm that I've just noticed that Jane Elson has now joined us, so welcome.
Fantastic. So we have a compliment from our health team. So agenda item 3 is the election of chairman. So I'll now ask the board for any nominations for the role of chairman, and request that you indicate in the chat box by stating RTS. If you have a nomination. If there are more than 2 members of the board nominated, we will conduct a secret ballot. So do I have any nominations? I'm just looking in the chat box now. Tim Goodson. Sorry.
Yeah, hi, so I'm Tim Goodson, the Chief Officer for Dorset CCG. I'd like to nominate Councillor Vicky Slade again for a second term as chair. Thank
you for that, Tim. Do I have a seconder?
Yes, Councillor Kieran Wilson. I'm happy to second that.
Okay. I've got a request to speak from James Vaughan.
Councillor Wilson beat me to it, Councillor Slade. I was going to second your nomination.
Bless you. He didn't put in a request to speak. He's a naughty boy. Thank you for your confidence. Do I have any other nominations? Give people a moment, because they're all rushing up to take my chair from me. I don't see any other nominations, so I am delighted to accept your nomination and your confidence for another year in leading the Health and Wellbeing Board. Thank you very much for that. That brings us on to the election of Vice Chair. So do I have any nominations for the role of Vice Chair? I don't think I need to put anything in the chat for request to speak. I would like to nominate Tim Goodson from Dorset Clinical Commissioning Group as Vice Chair. Do I have a seconder for that? Councillor Kieran Wilson, you were first in.
Yeah, I put in the RTS this time. Yeah, I'm happy to second that.
Okay, thank you for that. Do I have any other nominations? Okay, so in the absence of any other nominations, and of course because he's the best person for the job, I'd like to confirm Tim Goodson in the role of Vice Chair for a second year. Thank you for that, and I hope we're going to have another interesting year in trying to move this agenda forwards. Agenda item 5 is declarations of interest. Do any board members have any disclosable pecuniary interests or local interests in respect of the issues before the board today? If you're not sure and anything comes up as we move through the meeting, then please do just let me know in the chat box if you feel later on that you need to declare an interest that you've not realised at the beginning. So no one's requesting to speak. Brings us agenda item 6, public issues. We've had no public issues raised with us for the meeting today. Agenda item 7 is confirmation of the minutes. So we have 2 sets of minutes here to approve, the 4th of June and the 2nd of July 2020. So subject to agreeing the following amendment on the 2nd of July, on minute 55, BCP Local Outbreak Management Plan, will recommendation B, we remove the word clinical to be deleted to enable more flexibility in the membership of the subgroup. So can I just confirm if there's any dissent from confirming those minutes and accepting that minor change? Silence. So in that case, for the purposes of our officers, we can take those as accepted. That would be great. I feel like there's going to be a very big pile of papers for me to sign at some point. It might be a good idea to set up a day for me to sit with my fountain pen and sign a load of things off at some point in the near future.
I will make that arrangement, Chairman.
Yeah, let's find a space in my diary. Okay, agenda item 8, the Health and Wellbeing Board Business Protocol Membership and Terms of Reference. So I'm going to ask Karen Tompkins, Deputy Head of Democratic Services, to introduce this item, which explains a bit about how we operate. So Karen Tompkins, over to you.
Thank you, Chairman. The document is circulated with your agenda. Just to clarify, we normally as a board take the opportunity to review the membership, the business protocol and the terms of reference when we've elected the chairman and vice chairman, which obviously we've just done. It's before the board obviously to consider any changes that they wish to make. Obviously that may, I appreciate there may be some comments in the context of the membership of the board that you may wish to consider. Yeah. But indeed, if there are sort of practical operational issues relating to the business protocol where as a board you want to tweak those, then obviously we can look at those as well. And equally, it's about making sure that you're confident and happy that your terms of reference reflect the operation of the board. Happy to respond to any questions if there are any.
Thank you for that, Karen. So I just would like to raise the fact that we have been speaking since quite early on about the fact that there is no education representative from outside of the council. We have the Children and Families portfolio holder and the Director of Children's Services, but in the same way as we have external representatives, I felt quite strongly that having representation from schools or early years would be helpful. I have had a couple of suggested representatives given to me. We have yet to obviously speak to them about their willingness to serve, but I wonder whether anyone has any further comments on whether this would be a useful addition to the board. Conscious of not wanting to make the board too big, but make sure that as the children's agenda is so important, that we should have an external representative from that body. Councillor Moore, did you want to make any comment on that?
Yeah, thank you, Leader. Yeah, definitely. If we could have, a community-minded head teacher would be really, really helpful, or, even a trustee or governor representation of some description, or even, somebody from the, parents' voice and that sort of thing. It would be really helpful. Yeah, thank you.
Okay. Elaine Redding, did you have anything to add? I don't know whether you've experienced this on previous health and wellbeing boards, other councils that you've worked with.
Thank you, Chair. Yes, I am familiar with education reps from the mixed landscape. So we should explore academies and maintained, and I'm very happy to support the board with formal request for that to happen.
Okay, thank you. Sally Sandcraft.
Thank you. Yes, no, I'd just like to echo support for including education leaders on the board. I think it would be a valuable contribution.
Okay. So if with everyone's agreement, Elaine has given us a couple of recommended people to speak to. Elaine, can I leave it with you to ask? I'm happy if you'd like me to formally write to them, if you can give me their details. I do know one of the suggestions because my husband worked for her until recently, so I know her. But I'm very happy to write formally if that would be appropriate.
That would be exactly the way to go forward. Thank you. Yep. I'll work with you outside that.
Yep, great. Okay, that's lovely. Does anyone have any further comments or suggestions in terms of the terms of reference, membership, etc.? If not, we will take those as standing, and obviously if anything else comes up during the year, we can always put them forward for next year. Okay, that brings us then to agenda item 9. I'm delighted to introduce this item, which is safe and well checks. I just want to briefly, before I introduce Seth and Sarah from Dorset and Wiltshire Fire and Rescue Service, just make a small comment of my own, if I can. We've been trying to get this on the agenda of the Health and Wellbeing Board for quite a while, and I'm absolutely thrilled we finally got there. It's always fallen off the agenda. The work of the Safe and Well team I have personally experienced. I spent a day a couple of years ago when I was on the Fire Authority myself, working out with the Health and Safe and Well team, visiting residents in their homes, and the work is absolutely inspirational. And I was really keen that we moved away from the idea that this was about fitting fire alarms in people's houses. It is so much more than that, and I am delighted to welcome Seth and Sarah to tell us a bit more about how the work of the Safe and Well team and the prevention team in the fire service help us all with the health and wellbeing agenda. And I would absolutely encourage all of the partners to engage as closely as they can with this team for vulnerable people that they're looking after, because they've got an enviable reputation in the way that the public perceive the fire service. So I'm going to pass over to Seth and Sarah to give us a bit of a presentation.
Thank you, Chair. Firstly, I'd like to thank you again for the invite. I know that the time is really valuable and hard push to get on the agenda sometimes at the Health and Wellbeing Board, but we appreciate the opportunity today. So I'm shortly going to hand over to Sarah. The main thing I just wanted to reiterate, and it really came from a Health and Wellbeing Board a couple of months ago, where we had a from I think it's the chief executive of the Bournemouth Hospital was talking about trying to cut down on the admissions coming into hospital. And Safe and Well really offers a huge opportunity to do this. It's really about getting upstream. It's not just about fitting smoke alarms. It's about looking after vulnerable people in the community and seeing if we can either signpost or give them the education so that they don't then become a further burden on the NHS and on our health partners. So I'm just going to move away from the screen, socially distancing, and let Sarah stand in front of the camera. She's going to give you a presentation. Karen, can I ask, are you going to drive the presentation, or would you like that?
I'm going to now share my screen and hope that everybody will be able to see the presentation. So if you just bear with me.
Okay, I'll hand over to Sarah now and I'll catch up with you shortly. Thank you.
So can everybody see that presentation?
Yep.
Yeah.
Sarah, can you see that okay?
Yeah, it's fine.
Yes, I can see it.
So I am going to now start the slide. There you go.
Thank you.
All right.
So welcome everybody. Today I'm going to talk about Safe and Well and the team that deliver the Safe and Well visits to people across Dorset, Bournemouth, Christchurch and Poole area. If you can go to the next screen please, Karen. A couple of facts for you. Did you know that you're twice as likely to die in a fire if you don't have a working smoke detector? That 90 people on average die each year because their smoke detectors aren't working. Over half the home fires are caused by cooking. Every day someone dies from a fire caused by a cigarette. And 40 overloaded sockets cause around, funnily enough, my face is right in the way. I'm going to see if I can drag and drop myself. How do I do that? I can't see half the screen, apologies.
Let's take you.
There we go. Apologies. So 40 electrics, and that includes appliances, so fridge, freezers, things like that, and wiring, cause around 7,000 house fires a year across the UK. So if you can move on, please, Karen. And on average, it does cost society £1.65 million for every fire death. And that includes things like the fire service turning out, the ambulance staff, admission into hospital, insurance purposes. So in total, it can average 1.65 million for every fire death, which is basically why we have a Safe and Well team to stop these happening as best as we can. Thanks, Karen. So this one is, we've slipped this one in basically because obviously it's now September, and we do know that in the winter months we have certain fires that increase. This includes chimney fires, again overloaded electrical sockets where people are bringing out heaters, and they can bring out old heaters. That heater that's on the slide there, that was an actual heater that was taken from somebody's home and replaced with one of our temporary heater loans that we do.
Has anyone else lost sound?
Yes, I have too.
Steph, I don't know if you can hear us, but we can't hear Sarah anymore. I'm just trying to establish what's happened to the sound. I'm sorry, everybody. We seem to have lost Sarah's sound. I'm not quite sure whether Sarah's been inadvertently muted.
If you bear with me, I'll see if a colleague can ascertain as to what's occurred, and we can get them back on the call.
If we could just give it a minute or two, if there is a problem, then we may need to move
Can
forward
I
and come
just
back.
double check? It looks as if Seth is on mute. Can he unmute himself?
I think that everyone has been muted. Apologies. Yes, I think it might be wise if we could just adjourn the meeting for a moment or two. Apologies to the public. We will be back with you shortly when we've dealt with our technical hitch. Apologies for the technical hitch there. We had a problem with the screen. So I'm going to call back on Sarah Moore from the Fire Authority to update us where she left off. Thank you, Sarah.
Thank you. Apologies again. So we were talking about winter-related incidents, and obviously coming into the autumn, this will increase for us. We do focus on chimney fires, overloaded electrical sockets. We find heaters being used like the one in the picture, and surprisingly the number of people that actually dry their clothes and other items on their cookers just to save money and fuel and things like that. So all of these things we look out for when we go and do our visits. Karen, can you move to the next one, please?
Yeah. Oh,
thank you.
Jumped one there. I think that was the next one.
Yeah, so this is just briefly to explain that there are two different sides of fire safety. So we come under prevention, which is the domestic fire safety, and we've also got a protection team, which are the commercial fire safety, and they're the ones that have to adhere to the rules, and they cover buildings, shops, cinemas, workplaces. We're under the domestic fire safety and the prevention team, and all the information we give is only goodwill advice. So when we go into people's homes, we can't make them change their habits, we can't make them smoke safer. We have to talk to them in a way that we hope that they take on our advice. If you can move to the next one, please, Karen. So this explains what my team do. So I've got a team of safe and well advisors that are locality based across the whole of Dorset. We have got another team that cover the whole of Wiltshire as well. They are locality based and they cover areas within the county. So for example, there's a safe and well advisor that is based at Springbourne Fire Station, and he covers the Bournemouth area. So he covers the different areas within Bournemouth, the same with Poole, and we have somebody that covers East Dorset and down to Christchurch as well. All of the appointments that we make with people are arranged over the telephone. We talk to them, we make a time that's suitable for the occupiers, and when we go into their homes, obviously things are slightly different at the moment, so I'm talking generally without COVID, we will talk to them throughout their home, we'll walk through their home and look at all the different risks as we go through. And this includes things like in the kitchen, we'll look at risks in the kitchen, we'll even things like airing cupboards. You know, we're quite good at looking at all the different risks that we see walking through their home. Whilst we're doing this and whilst we're talking about fire risks, we've also got the ability to then see if there's any other issues in the home. So it could be that we see that there's a lot of medication being used, it could be that they're dependent on alcohol, or they're smoking, it could be they're very unsteady on their feet with mobility issues. And if we do notice anything like this, then we have got the ability to signpost through to other agencies, and this we do regularly. We have a process called SAIL, which stands for Safe and Independent Living, and that's something that we're looking to streamline and go online. And I've already had conversations with a team in BCP Council to make that streamlined in more easier to signpost through with the new front desk. I believe there's a new front desk coming with BCP Council, so we're going to align with them. All of the Safe and Well advisors have had training from Public Health, and this is all for healthy conversations, which include things like substance misuse, healthy eating, mental health issues, and slips, trips and falls. And as a fire service, we do target those that are most vulnerable, and we know statistically which types of people they are most vulnerable. We do carry out joint visits, so if there's a social worker working with somebody, we can go along with the social worker, or if there's a housing officer in a particular sheltered accommodation scheme, more than happy to do joint visits. And we fit free smoke and heat detectors where required. And like I've already mentioned, we do work with partner agencies to make sure that they've got all the support and assistance that they need. Next slide, please, Karen. So this is a list of the other things that we do within the team. So we offer a heater loan scheme. So if we see somebody that's struggling with heat in their homes during the winter months, we can temporarily loan them a heater. We don't advertise that publicly because everybody would want a free heater, but we promote this via our partners. So if partner agencies notice that somebody's got a broken boiler or they can't afford their heating, we will loan them a temporary heater, but we also forward them to an agency that will help them with their finances or getting a grant for heating and things like that. We supply fire retardant bedding and fire retardant spray. We go to a lot of people that heavily smoke, bed bound, and they drop their cigarettes in their bedding and things like that. So we can offer them fire retardant bedding. We supply extension leads. So for people that have got overloaded sockets and can't nip to B&Q or somewhere like that to buy themselves extension leads, then we'll supply them. We install deaf alerts for people, so people that can't hear their smoke alarm at night because they take out their hearing aids, we'll supply them with a deaf alert system, which comes with a vibrating pillow pad under the pillow and a flashing light next to the bed that's linked to the smoke detector. So they're alerted when they take their hearing aids out at night. And we do fit carbon monoxide detectors to those most at risk, and we do arrange talks and drop-in sessions. So for example, we were attending a leg ulcer clinic in Poole, and they used to take, they would drive the people, they would pick the people up that needed their leg ulcers redressed, they'd take them to the local hall, and we would come along and talk to them because they tended to be people living on their own, they had mobility issues, and we'd talk to them about fire safety whilst they were sat there having their leg bandages changed, which seems a little bit random, but actually they're the people that we want to get to and talk about fire safety in the home. Next slide, please, Karen. So the Do You Know a Charlie initiative we launched last year, and this is specifically aimed at partner agencies and health professionals. We have talked to numerous groups. I've been to Bournemouth Hospital, I've been to social work teams across the county, domiciliary care agencies, talking about our Do You Know a Charlie initiative. And the Do You Know a Charlie initiative is based on those we know are most at risk of fire. And the Charlie stands for care and support needs, hoarding and mental health issues, alcohol and medication, reduced mobility, lives alone, inappropriate smoking, and elderly at 65 plus. and they are the highest risk of fire people that we know have fires in the homes. So what we want to do is promote this to the health professionals, so that if they come across somebody that's got any one of those issues, it doesn't need to be all of them, they can refer through easily to the Safe and Well team and the fire service. And the information is actually on a credit card sized card. So health professionals can keep this credit card in their pocket, and when they're out and about doing their visits, they've got all the contact information they need on this little credit card sized information card. And it's even made of the plastic credit card type material, so if it gets washed in a uniform or something like that, it's not going to disintegrate into pieces. And it's very, very successful. We've been, like I say, to numerous GP surgeries, district nurses. We're trying to roll out this Do You Know a Charlie initiative to as many health professionals that are going into people's homes or coming across people with any of these issues as we can. Next slide, please, Vicky. Oh, is it Vicky? No, it's Karen. Sorry, it's because I can see Vicky's face.
It's all right.
These are some of the added risks that we come across a lot. So we go to a lot of oxygen users, because obviously oxygen cylinders are not very good in a fire, so we want to make sure that they're as safe as possible. Emollients, so we've been to a number of incidents where the resident was using emollients for health issues, and they're petroleum based, and obviously petroleum based products in fire don't mix very well. Hoarding, and anyone that's like bedbound, bariatric patients, all of these things that we want to know about, so that we know what we're dealing with if we're going to a fire. So we want to be seeing or going into the homes of the people that are specifically in that category. Next slide, please, Karen. So in the BCP area specifically, we know that there's quite an elderly population. It can be quite transient with regards to the university that's there, seasonal work that's there, and we also know that there are some areas of deprivation. And just a figure here, in the year 1920, approximately 4,000 safe and well visits were carried out across the BCP area. And as we only visit those that are most at risk at fire, they were all vulnerable people. So that's just a figure for you all to know that during the 1 year period we did visit around 4,000 properties within the BCP area, carrying out safe and well visits. So as you can see, we do get into quite a lot of people's houses, and I always feel that we are far more welcome in people's houses than maybe other people like the police or, you know, a social worker or somebody like that. We always tend to be quite welcomed in properties. Next slide, please, Karen. So this is just wrapping up now. So this is what we say to people: if you know of anybody, especially if they come under any of the criteria on the Charlie card, then you can send them through to the Safe and Well team. We've got a website with a referral portal that you can put people's details on there, or you can email there. It's safeandwell@DW Fire, and we've got a free phone number that people can call as well. I would say if you've got any questions about Safe and Well, or if you would like a presentation to any of your specific teams about it, or if you know anybody that needs a visit, then just get in touch. Either email the Safe and Well email address there, or Karen's got my email address if you would like a presentation or further details about how we can work better together. Then by all means either get hold of Seth or email myself, and Karen's got the details. If you've got any questions, then email me, because I think my time's up now and I can talk for England, so I'm going to go. Thank you.
Thank you, Sarah. That was fantastic.
Thank you.
Great to hear more about it.
Thank you.
So does anybody have any questions or queries they want to raise now for the purpose of the public meetings? I think if there's anything burning, it's good to let the public hear what our issues are. I have a couple of requests to speak. The first one is Jan Thurgood, the Director of Public Adult Social Care. Jan?
Thank you, Chairman. I just wanted to say, really endorse the joint work with our new adult social care contact centre, which we're developing for implementation in the autumn. So I think a really strong connection with the Safe and Well Check team is great, and good to hear that those discussions are happening. We also wanted to highlight that we have a multidisciplinary hoarding panel, which looks at situations where people are vulnerable and hoarding, and I know Fire are engaged in that, and that's really helpful. The other thing I just wanted to ask was whether Sarah is just able to give us just a little insight into how the team is working in the COVID period, given they're going into people who have who are vulnerable and have health needs. That might something just a short window into that would be really helpful.
Yeah, you cut in and out there, Jan, but I think you said, what are we doing currently in this current climate? What we're doing at the moment, and what we have been doing for the past few months, is the majority of the advice information that we're giving people is done over the telephone. So we're telephoning people first instance, we're talking through the home safety over the phone, we talk through the layout of their property, whether they've got any health issues, and whether they've got any smoke detection, even to the point we're asking people to test their smoke alarms whilst they're on the phone to us, so we can actually hear them being tested. Currently, we're visiting those that are most high risk that need equipment fitted. So the Safe and Well advisors are fully suited and booted in PPE. They've got the masks, the visors, the double glove and aprons, everything. We are only going to those that are most at risk that need equipment fitted at the moment. But we certainly are still engaging with our partners. I know members of my team are going to MARMS meetings virtually. With signposting through, still if there's any health needs. So we're still delivering a service, but we are prioritising the most at risk that haven't got smoke detection at the moment. But I think things will start to ease off as things change with regards to levels of lockdown and things like that. But we are still delivering a Safe and Well service, albeit most of the advice is done over the phone and the amount of time spent in a property is kept to a minimum.
Thanks, Sarah. We've got quite a few requests to speak, which I'll run through, but just a couple of people are struggling to actually unmute. The first thing is, can we have a copy of the slides sent to partners? And I presume that the slides will be with the minutes, so they should be accessible through the website as well, I presume, if that's allowable.
Chairman, just to clarify that I can certainly make the slides available to the board and publicly available when we publish minutes.
Lovely, that's great, thank you very much. I'm going to run through the RTSs because they might cover some of the things other people have said. So the next one is Kieran Wilson.
Thank you, and thank you for your presentation. Jan's stolen my question. I was going to ask around the challenges you've had during COVID, but I think that this work is a really important piece of work. 4,000 visits is a really incredible number, and I think fire safety is such an important thing. And from my experience, some of the complexities that some of our residents have in terms of mental health issues and hoarding and things like this, it can be quite difficult and quite a challenge to engage with people. So the fire service doing that work and coming from an outside organisation, a trusted organisation, it really helps. So really, I just wanted to endorse that work, really. Thank you.
Thank you for that, Kieran. There was a question from somebody about talking about how fantastic this prevention work is done by trusted teams, but the question around it, which links to what Kieran just said, was 4,000 is an impressive number in a year, but it'd be good to understand whether it's possible to measure the impact of these visits over time. I just wonder whether you might be able to answer that before I move on to the next person.
I think we've had this conversation dozens of times to try and measure how the impact of installing a smoke detector, for example, is going to, stop somebody from dying in a fire. I think it's something that people have worked on. We've tried to work on. I think Seth might. The fires are going down, I'm being told. So I've got Seth sat here saying, because he knows these things more than I. So we know the numbers of fires are going down. We know the numbers of fire deaths have gone down. With regards to the health implications, when we're signposting on, if we come across somebody that's got mobility issues or tells us they've had 3 falls in the past week, that's something that we can't measure at the moment. because how do we do that? How do we know that the conversation that we had with them and then signposting through to adult access actually stopped them having another fall? But I know it's discussions that are had a lot as to how our conversations, you know, how can we measure that? I know it's a tricky one.
Vicky, it's Seth. If I could just come in there. So I know that discussions are being held at national level amongst the National Fire Chiefs Council to see if we can establish a robust evaluation scheme. And I know the SLT for the fire service are very keen to see if we can work with partners to see how we can almost trace those people that we have those interventions with. Because if we can get upstream and stop the little old lady falling over, it's got to be better for the lady. It's got to be better for the health partners. It's got to stop bed blocking, and that has huge financial implications. So there's possibly some work here that we can do with partners to see what we can do in terms of, well, firstly the research, and secondly potentially in terms of commissioning. Obviously we've got a number of staff that are fitting those 4,000 smoke alarms. Those people are already identified as high risk, and we do that through our data sharing agreements, through information such as extra data. So we are already targeting the most vulnerable in the community. If the Health and Wellbeing Board were minded to consider a wider work in terms of perhaps some locality-based slips, trips and falls work, then we'd be happy to see what we can do with our partners on that.
Okay, thanks for that, Seth. Councillor Debman has a request to speak.
Yes, thank you, Chairman. And I must apologise for coming in late. I had a technical fault. I was really interested in this presentation because obviously I've seen it all on the ground and I know how people value it. And they're actually thrilled to have the fire service helping out like this. I have a question which might not be able to be answered right now, but one of the figures was 7,000 house fires a year caused by electrical faults. I'm really worried about that. And I just wondered if there's any differentiation when you do these figures between rental properties and owned properties. You don't need to answer now, but would that figure be available at any point?
Possibly. That would be a bit of work that somebody would have to drill down into. I don't personally, I don't think that there's any real difference between rental or home-owned properties. When we talk about things like the appliances, faulty appliances, you know, it can be a particular brand of a fridge freezer maybe, or a washing machine that needs recalling and things like that. And those sorts of things, unfortunately, a lot of the time you can't do anything about, but the sort of information we give to people is don't use your washing machine overnight, you know, make sure you keep your kitchen door shut at night. There's heat detectors we can put in some kitchens, so there's ways to try and lower the risk of it happening, but there's certain fires you can't stop happening, if that makes sense.
Right, yes. Can I just say on that before, I don't want to carry on too long, but obviously I was thinking more of the electrical fault within the wiring of the houses. So, but obviously, as you say, yes, I know there used to be a big scare, didn't there, about electric blankets and things like that. Yes, I understand that now. Thank you. Thank you, Chairman. Thank you.
Okay, thank you. Councillor Moore.
Yes, thank you, Chairman. Can I just thank you for the really good presentation. I have, as a ward councillor, made referrals myself, but now I've actually got your contact details, because what I've done is I've got a fire service officer that's very friendly, lives in the ward, and I've always emailed him and given them the details, and he's done it for me. Now I every time I did it, I thought I ought to be doing this myself, really. Now I've got the contact details, I will. The only other thing I was thinking out loud here, that I am part of a local neighbourhood watch, and this is something that the neighbourhood watch could actually get involved with, making referrals. Presumably you've got leaflets and I can get hold of them and
absolutely.
Do it that way, and you would be really good for a talk at a future AGM when we can actually do it, you know, live rather than on Zoom or whatever. So I'll make sure I'll bear you in mind for the future.
Please get in touch, because I have been to a number of neighbourhood watch conventions or AGMs. Elaine Ryan, who was in the prevention team with the Dorset Police, she was my contact, and I've been to probably 3 or 4 neighbourhood watch AGMs across the county, and like you say, when things are a little bit more back to normal, drop me an email and we'll certainly come along and talk to your neighbourhood watch teams.
That's lovely, thank you.
Thank you for that. I'm pretty sure we had them at Broadstone a couple of years ago, because obviously Ben Ansell is one of our residents, so we've got the connections at the top. Okay, a couple of questions around the health agenda. Do you feel you have strong enough links into the primary care networks and GP practices? And then a second question on the same thing is, worth seeing if a flag could be put on the GP system as to whether someone is referred to or in contact with SAIL or Safe and Well. Is that something you may be able to engage with the GP network on?
Yes, and just before the COVID happened, we were making inroads into GP surgery. So we've been to the Camford Heath practice. I know it's not in the BCP area, but for example, we've started working out of the Blandford hub, where they've got a community hub there. We've been to Alderney Hospital, and we're looking at working in that out of their offices there. So we actually integrate better, and we're spending more time with the people in the different surgeries. I know that a number of my team now are included in practice manager meetings at some GP surgeries. To be truthful, we've always had a few issues trying to get into GP surgeries. I understand how busy they are, but we were just making inroads into that prior to COVID. So it's definitely something that we will be doing more of once we're allowed to. But it was starting to work really well. Three-legged cross was another one we were getting into in West Moors, so it was working very well. We had lots of good news stories about it and feedback how well it was working, and we were just starting to roll that out with regards to the GP surgeries. So any contacts you have, or if there's any links there with people that want to get in touch with us to make that happen as we move forward, that will be greatly appreciated.
And speaking from the experience I had out with one of your officers, when we identified somebody at risk and realised that there was going to be difficulty to advance things on, we actually visited the GP surgery and were able to speak direct to the GP to actually get some measures in place in the wraparound that the fire service couldn't access straight away. So, even where there isn't that pre-relationship, there is that sort of multi-agency approach when there's a referral that's live, which was amazing to watch that go into action. I've only got one more request to speak at the moment, which would be great if we can then move things on, and we've obviously got your email address for anyone else that wants to raise things later, and that is Kate Ryan, the Corporate Director for Environment and Communities, please.
Thank you, Chair. Yes, so I just wanted to say from the landlord perspective, BCP Council has 10,000 homes across the area, and just wanted to thank the team for the joint work that we do with them, for their efforts across our stock in terms of performing these visits and working really collaboratively and positively. So I've had really good feedback about the work that we do on complex cases. So just wanted to feed that back. So thanks very much, and look forward to that carrying on when we're slightly more back to normal.
Thank you.
Okay, there's a couple of comments in the sidebar which I'm sure Seth and Sarah can see. If I'm going to bring that to a close at that point, and just say thank you to Seth and Sarah for bringing that to us. I'm glad we finally managed to get it onto the agenda for everyone's benefit. Yeah, just really to note the presentation for the record. There's no actions that are required as a result of it, other than make sure you take down the email address and use it. So with that, I will move it on to the next agenda item, if that's okay, which is the Health and Wellbeing Strategy for 2020 to 2023. I'm going to call on Sam Crowe, Director of Public Health, to present the report, and the recommendations around this are that we approve the attached draft strategy, adopt a sponsorship model whereby board members champion specific areas. So if I pass to Sam and then take questions afterwards on the details. So Sam, over to you. Okay. Sam doesn't appear to be able to unmute. Not quite sure why not, as he's presenting.
Right, can you hear me now?
I've just unmuted you, Sam. It's Karen, so hopefully that will be okay.
Fantastic, thank you ever so much. So I'm delighted to introduce this draft strategy for the board today. I just wanted to make a few points by way of introduction. So the board's required to have a joint health and wellbeing strategy that sets out how we will work to discharge our duties to promote integration and prevention. And if you cast your minds back, I think it was November 2019, the board gathered for a development session, and we discussed within that session the framework for the strategy, which was going to be based around 3 priorities. And we decided on empowering communities, promoting healthy lives, and support and challenged partnerships to improve outcomes for residents. So the draft strategy that we've prepared for you today covers those 3 priorities. It sets out what we're asking the board to do over the 3-year period, 2020 to 23. And at the time, we agreed that there would be annual themes within the Healthy Lives priority. And originally, if you remember, we selected physical activity. Then we had the COVID pandemic, and as we've been discussing through the response to the pandemic, board members considered that it was probably worth reviewing this. Realistically, we probably wouldn't be able to achieve too much on that theme within this year. So what we've agreed within this draft strategy is that we will focus on improving mental health for the first 15-month period, and then the board will then move on to focus on eliminating food insecurity as the second priority within the Improving Healthy Lives theme later in the strategy cycle. So there are obviously strong links between this strategy and the BCP corporate strategy, especially Fulfilled Lives and Brighter Futures, but there are also important strands in the work of the Council in improving communities and particularly the more deprived areas. It's also important that the strategy dovetails with the work of the integrated care system, and I know that at the moment the Systems Partnership Board is considering its draft priorities, so really important that we have that very, very clear connection, particularly around improving health and wellbeing with our integrated care system priority. The focus on deprived communities will be even more important in the recovery period from COVID, as well as that priority on the theme of good mental health. And I just remember when we were looking back over the initial period of the pandemic, some of the surveys that the Office for National Statistics did throughout the months of April and May showed just how important that's going to be, I think, going forwards. So the ONS regularly surveys the population on a number of metrics of health and wellbeing, anxiety, how satisfied people are feeling with their lives. And what was really striking about that period in April and May was just how high the proportions of people were reporting that they were experiencing some form of mental distress, particularly anxiety linked with worries about their financial future. So I hope that you've had a chance to look through the framework in support of this strategy today, and we're asking the board to approve the draft. The other key recommendation today is to seek the board's support to adopt a sponsorship model going forwards. So we're looking for key members of the board and organisations that support and contribute to the work of the board to come forward and sponsor some of the main priorities and themes within the work as we go forward. So I'm happy to leave it there, Chair, and perhaps we could move on to discussion about the content of the strategy and take any questions.
Yeah, of course. We have one of our partners, Elaine Redding, from the children's team, has had to leave but has asked how she's able to sponsor. So at the end, we will be able to send out sort of requests for how people can do that, which I think is really important. Richard Renaud from the Paul and Bournemouth hospitals was beginning to type in the chat box. Richard, did you want to speak? Karen, have we unmuted all of our participants?
Just to clarify, Chairman, according to my records, Richard is currently not muted.
Okay, so Richard has put a comment in the side. I'm assuming he's struggling to speak. It fully supports excellent plan, clear priorities. For the service reconfigurations, there is a clear set of patient benefits. So I don't know why we've got problems with the sound today. Does anybody else wish to speak on this in terms of comments about the strategy? Jenny Douglas-Todd, would you like to say anything? If you can. Yeah, people are telling us they're muted.
Chairman, just to clarify, looking at the record, Jenny is currently not muted.
Okay, everyone is telling me that they are muted. Are we sure that there's nothing on there where we've muted participants, which we had earlier, that everybody was muted by the presenter, by the organiser? The buttons won't untoggle is what people are telling me.
Okay, Chairman, whether you want to take a short adjournment so that we can try and address this issue.
Okay, I'm going to adjourn again for a moment because it's really important that we do have some engagement on this really important strategy. So apologies to the public who may be watching. We will take a short adjournment. Hopefully we're back in a couple of moments. Apologies for that short adjournment. So we are moving from Skype to a new system shortly, which hopefully won't be so clunky and muting people without them knowing they're muted. So we've got a number of people who have said they like the strategy and support the plan. Comments about it focusing on a few areas. I think it is worth saying that we had originally planned 3 areas, and it's really important that having 2 gives us more time to be meaningful. I don't see the point of having tick box exercises. Richard Renaud, would you like to speak?
Thank you very much. So yes, fully support and also the 2 priorities, and particularly the mental health one, as Sam said, for the reasons and the COVID psychological burdens are very high, and Tim and I were just hearing some of the studies coming out about the extent to which patients and staff are affected, so strongly support that. In terms of just expanding on the point I made in the chat, on the priority around the service reconfigurations, there's a strong set and published set of patient benefits that we'll be tracking. So as we do the reporting on the progress against the plan, then obviously we'd be able to supply those as we make progress against those, although that is over a 4-year period, because most of the reconfigurations are sort of 4 to 5 years away. But we've some already beginning to happen as a result of merger. I'm very keen to share those as part of the update on the strategy.
Thank you for that, Richard. Lots of messages saying the people are supportive. Nobody else asking to speak specifically about the plan, apart from Jenny. Jenny Douglas-Todd, would you like to speak?
Sorry about that, Vicky.
Go ahead.
Yes, I just wanted to publicly support the strategy, and for me, particularly the focus on the promoting healthy lives is really important. If nothing else, the COVID-19 pandemic has shown us that actually being healthy is one of the ways that we can fight such diseases and illnesses. So the focus around getting healthy, and particular improve the mental health over the next 15 months, which we know has been a real challenge for people old and young, getting through the pandemic. the focus on mental health is an appropriate one. And as an ICS, we look forward to working with you in supporting that agenda.
Thank you. Councillor Dedman.
Yeah, sorry, Chairman, you said it so quickly I hadn't got time to
weren't expecting that, were you?
myself on, caught out there, but I wasn't eating my biscuit. Yes, I just want to support it, obviously, and also say I think the work on inequalities is very, very valuable. I think there are more inequalities than we actually know about, and I'm looking forward to helping iron some of those out. So yes, very supportive of all of it. Thank you.
I just want to touch on the second priority, which has come. It was important, although we hadn't agreed the next priority, one of the bits of feedback we had from public health was the need to have a lead-in time to decide the future. And with the work we started about this time last year on hidden hunger, and a request that came from the food poverty team a few weeks ago to say, could the Health and Wellbeing Board pick up the governance around dealing with food poverty? And at that point, it became fairly clear that the inequalities and the hunger agenda was something that felt right. And so, speaking to the vice chair and the public health team, their view was that planning in advance what the next theme would be and making it something that was about well-being that supported health was something we should put in the strategy rather than talk about it in a year. So I hope that that's something that you will all support, as I think if we can eliminate hunger, we can demonstrate that quite clearly. And it feels to me like something that nobody should be suffering hunger in the 21st century in a supposedly wealthy community. So I hope that you're comfortable with us putting that into the strategy. Richard Renaud, did you wish to speak again rather than type it?
I completely agree with that, because it's much more effective in the planning period, but also to link into the national campaigns. So there's obviously Mark Rashford and the Food Alliance around school age hunger particularly. So it would be good to just ensure we're aligned with the national as well.
Yeah, and I think it's really helpful that the food poverty team have asked us to provide the governance. So they've asked us to put it on our agenda for a 6-monthly update, so that we can actually look at the effectiveness of things like our community fridges and how many isolated people are actually choosing not to eat, the heat versus eat agenda. So it's a really good thing that we can get working on. And of course, the GP networks and people like fire service going into people's homes are a really good way of spotting where there's potential for people who are not reaching out for support. If everybody is comfortable with that, Jenny is typing another message. Did you want to say anything else before I move this on and hopefully adopt the recommendations?
No, I was just supporting the point that you made, Vicky, around food poverty, not just being with young people, but with our older population also. So it's quite important that we look across those age groups.
Thanks, Jenny. Okay, so we have some recommendations here, which is to adopt the strategy. I'm just getting it up in front of me. Approve the strategy and adopt the sponsorship model. So I wonder if we could ask board members to have a look at the strategy and look at the specific areas within that offline, and come back and sort of let us know what they'd be like to sponsor. I mean, it makes sense for our children's representatives to look at some school hunger and the inequalities issue around the communities, potentially people like GPs and things like that. So have a look at it. We'll bring that back, because I don't think it's necessarily a good idea to everyone to be pitching for which bit they want to sponsor today, if that works for everybody else. There was originally a plan to have a line where we signed up for various elements, but that feels a little bit too structured at this point. Sam, can I just come back to you for any final comments and before we move this to adoption?
Thank you, Chair. Just grateful for all the support and all the comments really from board members. I completely agree that it probably needs further discussion about developing a really strong sponsorship model. We could have put suggestions in the draft strategy, but that's not the way to make sure that we've got real ownership around the agenda. So I certainly look forward to moving this on, and I think having those discussions in future board meetings and getting genuine ownership around some of those key issues will be really, really important. I'd just like to also highlight there's a big national push coming down through NHS colleagues' work around inequalities. We'll be refreshing some of the public health analysis to support that. So fully endorse and support perhaps getting GP networks, primary care networks more closely involved on a locality basis to make sure that we've got, I guess, the full breadth of partners involved in the work.
Yeah, great. Thank you, Sam. Okay, so can I just check whether we have any dissension from the recommendations? Otherwise, we'll take them as adopted unanimously. Giving a pause for anyone to dissent. So without any dissent, we will adopt those and move on to agenda item 11. Agenda item 11 is the application for the Care Act easements for BCP Council's adult social care. There have been some revisions to this in August. So I'm going to call Jan Thurgood, Corporate Director for Adult Social Care, to present the report on the application of the care easements. Jan, can I pass over to you, please?
Thank you, Chairman. This is good news. Board members will remember that we brought a paper in the spring where we set out the 3 easements that we needed to make under the Coronavirus Act in relation to access to adult social care. And they were all related to our ability to deliver services when we needed to enact social distancing. So the good news is that in relation to our services for people who have a hearing loss or are deaf, we no longer have easements in place because we are now able to visit people and resume services. In relation to occupational therapy assessments and the provision of equipment and adaptations to people's homes, again, we're now able to enact to deliver those services together with partners across the council and with external contractors, so that's extremely positive. We do still have an easement in relation to our day opportunities and day centre services. So there is now national guidance issued by Sky, which is the social care national body, around how to safely consider opening up day opportunities and day centre services. That national guidance acknowledges that it will not be possible to provide services for the full range of people or to the intensity for some of those people that was provided before the pandemic, given the kind of measures that need to be put in order to provide safe services in the light of COVID-19. So we are working with all providers of day centres and day opportunity services about how they can begin to provide services safely through this period, and it is encouraging that we're able to, they are able to provide more services for people with people who need support in day opportunities and their carers. However, it is a more limited service than was able to be provided before the pandemic. And also we will have to be very mindful of if there were to be any community rise in the number of cases of COVID-19, we will take advice and continuing advice from public health colleagues around whether services can continue, need to be reduced, or might even need to be ceased if we had a very steep rise in community cases, given the health vulnerabilities of many people who attend day centres. So it's an update for the board, positive progress made, and we will come back to the board if there's any substantial changes in relation to easements as we go through the winter period. Thank you, Chair.
Thank you, Jan. I've got a request to speak from Councillor Debman, please.
Yes, thank you, Chairman. Yes, Jan obviously has said it all about the report, but I'd just like to say that we've managed throughout the whole period to provide really good care and support, and I'm really proud of what everybody has done. I mean, I see the directors on a regular basis, but I know everybody all the way through the organisation with adult social care and health has been very, very keen to keep on giving all the support we need. And the other thing I want to mention, that does come out in the report, but there are quite a few people who are not really very keen to have people visiting them at the moment. There's still a lot of people who, whilst not shielding, are certainly not very keen to have people coming in, and we're taking that very much into account. So really, Chairman, I just wanted to commend all the staff throughout the organisations, our own organisations and the partners. It's been a terrible period, and it's still being a terrible period in many ways. So I want to thank them all. Thank you.
Thank you for that, Councillor Dedman. Can I just raise a couple of things? The first thing was we were going to be looking at shortly the report on the survey from last year of how people felt, and it's quite clear that the population that we serve in terms of social care support, isolation and loneliness is really a big problem, and their lack of access to facilities, I suppose, is a problem. And this is a problem at the end of the last financial year, so it's likely to be a worse problem now with the limited access to day centres. I'm just wondering, from a wider perspective of partners, what can be done in the wider community, not just through the direct council services, to help to address this, and what communication is going on with the people that we support to let them know about how things are going with day centres. I'm getting quite a lot of people coming to me and saying, when am I going to get access to a day centre again? Why aren't I able to access my services? And it would just be interesting to know how we're engaging with people and explaining why we can't do it and what alternatives might be available in the community. Jan?
Just wanted to say, in relation to the first issue about isolation and loneliness, we don't have Karen Loftus with us today, but Karen might well want at another point to talk about the initiatives that the voluntary sector are taking. And for instance, this week there's been a very interesting initiative around young people and actually working and sending communications to people who are isolated or lonely or in care settings. So there's some very interesting work going on, which I think we could hear back as a wider board, and it's a shame that Karen isn't with us today because she could have shared some of that. In relation to working with people who receive day centre and day opportunity provision, there's a range of contact. For those people, we have written to people who receive services through social care, explaining the situation. We are supporting people who use direct payments to access services and communicating with them around the opportunities and also the decisions they need to make about safety. Also, individual providers are working closely with people who have services, and we will be looking at how we assess the needs of people in a systematic way for people who have services through social care. Given the number of people is around 700 who receive day opportunities and day support, our assessment programme will take some time.
Thanks. Okay. Does anyone else have any comments on that? Councillor Dedman, you wanted to come back.
Yes, thank you, Chairman, especially on your point, which is very, very valid about the loneliness and the isolation. When the council set up the volunteers, I can't think what they were called. I've been racking my brain.
Together we can.
Yes, that's it. I have a lot of empirical experience here of the people who have helped take food and deliver things to not only elderly people but disabled people in our local community. That's actually sticking, in that they now know the person that lives 3 doors down from them and they still go and see them. So I'm hoping that will be one of the ways forward, that instead of being isolated within your own community, in your own 4 walls, you will know a lot more people. So I think that was a really brilliant initiative by the council, and I think that's one of the outcomes of it.
Thank you, Councillor Dedman. I don't have anyone else indicating they wish to speak, and give one more opportunity to do so. If nobody else wants to speak, our recommendation from this is that we note the 2 previously applied stage 2 easements that are no longer required, but that 1 remains in place. So the easement regarding the deaf is no longer required. The easement regarding occupational therapy is no longer required, but the easement regarding to day centre closures remains in place, with day services continuing to be provided through alternative provision within the community or clients' homes, and increasingly through the resumption of some buildings-based day centre support, with social distancing and other limited measures which continue to preclude the full opening to pre-COVID levels for the foreseeable future. So if I have nobody else wishing to speak, do I have any dissent from those recommendations? Nope, not seeing any dissent, which means that takes us to agenda item 12, which is an update from Sam Crowe, the Director of Public Health, on the COVID-19 communication strategy and the role of the Local Outbreak Engagement Board. Sam, back over to you, please.
Thank you very much, Chair. So I thought it was timely that we come to the Health and Wellbeing Board to talk a little bit more about the role of the Local Outbreak Engagement Board. As board members will be aware, we've currently been developing our local outbreak management plans in line with national policy. BCP Council published its plan at the end of June, and at the previous Health and Wellbeing Board we agreed that the Health and Wellbeing Board would effectively function as the Local Outbreak Engagement Board. And this is a board that will play a key role in local outbreak management, led by the council leader and supported by the Chief Executive, Director of Public Health and the CCG Chief Officer, Tim Goodson. So we've made a huge amount of progress in preparing for outbreaks, working through the Health Protection Board, which is largely officer focused. I'm aware that the Health and Wellbeing Board members and the public probably haven't heard as much about the role of the Local Outbreak Engagement Board, and particularly the work contributing to our response to outbreaks or particular rise in community infection levels. So in any situation where we would be facing either increasing numbers of outbreaks in BCP Council area or a rise in the infection rate, the role of the Local Outbreak Engagement Board would be to communicate the key public health messages quickly, either to the public at large or to particular communities that may be more at risk, as well as providing oversight and assurance on the issues facing our residents. So as we go through managing and responding to the outbreak, it's really important that the public understand what it is that we know, the actions that we're taking and the progress that we're making. If you look at learning from other outbreaks that have been happening in other areas of England, particularly the Midlands and the North, it's clear just how important it is to have good communications. And so today we're presenting the communication strategy that supports the Local Outbreak Engagement Board and our wider outbreak response, but also it updates board members on the work that's been done to build a network of trusted voices. So one of the appendices takes you through the idea that we've developed behind a new project called Trusted Voices, where we're seeking the support of key people from communities who may be able to help us understand the community concerns more quickly, but also act as I say, a trusted voice back into those communities if we need to message really quickly, either public health messages about the actions that we need people to take quickly, or reassurance and assurance that we're on top of outbreaks, we're responding well, and we're managing to keep people safe. So the papers you have before you summarise our communication strategy, and there's a good example within there of the different types of messages that we'll be putting out under different levels under our outbreak management plan, and the Trusted Voices project, where we thought it would be really important to share with board members the thinking and the work that we're doing to develop that network of trusted partners and to really sort of step up our comms and engagement work, which is all part of our preparation. So I'm happy to take questions, but I'll leave it there for now, Chair.
Thank you, Sam. While I wait for the flurry of questions on the side, can I go slightly off-piste, please, and just raise something which is relevant? I think the public could potentially like an answer. Even this morning, we have problems with our local COVID testing centre, and I think there's a comms issue there around the fact that we have a testing centre in Poole, and even today the website is currently sending people on a 2-hour journey to their nearest testing centre when the local testing centre is open. What are we doing, or what is public health doing, and what as a system is being done locally to reassure people that they can get a test in the local area and that they should be continuing to sort of turn up when we've spent the last 6 months telling them please don't turn up? How do we respond quickly to these changed circumstances when it's so important that people get tests?
Yeah, so it's a national issue at the moment in terms of the laboratory capacity, and unfortunately it's quite a blunt instrument, the way that the national portal is being turned off to make sure that capacity is being prioritised in other areas. I'm told that this is a temporary measure and that there will be a lot more lab capacity coming on stream over the next 2 to 3 weeks. So it's partly because there's a lot more asymptomatic testing now being done in lots and lots of other groups. The testing effort is aware of that, and they're aware of the need to build lab capacity quickly. It's just that there'll be a pinch point for 2 to 3 weeks before that capacity is being brought online. Obviously, it's not ideal, and it makes it quite difficult on a local level when we are trying to encourage particularly people with symptoms about the importance of getting tested. I would still say that if people do have symptoms, it's really, really important that they do get a test. Obviously, we don't have control over the national portal. It's unfortunate that it is being switched off at short notice, but we've escalated this to the centre. They are aware that there isn't enough capacity, but they are working hard to resolve it.
So the advice that we should, I'm actually looking on Twitter at the moment, and this is all over the BBC, the Echo and Radio Dorset. 7 minutes ago was the 3 options I was given this morning by the website was Newport, Isle of Wight, Newport, South Wales and Torquay. The response should be go and head down there anyway, or don't get a test, or what is the advice that we should be giving people if we're asked?
So I'd need to understand the current situation at Creekmore. What I can do is to clarify that, and then we will use our Public Health Dorset feed to put out some helpful local advice.
Really helpful. Sally Sancroft has a request to speak, and I know Sally might be involved with this as well. Sally, do you have any words of wisdom?
Not any words of wisdom, but just to reflect and confirm my understanding is the same as Sam's. This is a really difficult situation around local messages because we've got absolutely no control around what they're doing around turning off the portal, and they are absolutely prioritising areas for access to lab capacity where they have got higher rates of COVID in their system and where they've got outbreaks. So it's really unsatisfactory. And I know from our testing cell lead, who updated us on the Silver Call yesterday, that our local access to testing is being turned off often by midday in day. So it is a real problem. I heard it on the BBC News with Simon Stevens responding this morning, and he wasn't able to give any immediate answers other than they're also really working on other technology. So I think it's quite difficult about our local messages when we have absolutely no influence other than the escalation that Sam described.
Okay, so I think, from my perspective, trying to sort of make sure we're giving out the right messages, that we've escalated this for Public Health Dorset to make inquiries and to watch for the Public Health Dorset updates via social media.
I will try and clarify, and we will put on social media some clear lines about what people should do.
Thank you for that, Sam. That's an exact example of what our communication strategy needs to be doing. And just for the benefit of the public and others that might be listening in, we do have a member briefing on the role of the local outbreak engagement board week on Monday. And we've got some tabletop examples that are being worked on, and the reason that the Chief Executive isn't with us on the call at the moment is he's on a national emergency planning exercise over a 4-day period, which involves what we might do if we have an escalation in conjunction with winter pressures and other issues that are coming down the line. So there is a lot being done, isn't there, Sam, in terms of getting us as prepared as we can be for any future escalations over the winter months, which I think is really reassuring. And it's great that the Chief Exec of BCP Council has been asked to represent local government in that field. Okay, I am seeing no other requests to speak, and the recommendation on this is to note the development of the local outbreak management plan communication strategy, note the role that the local outbreak engagement board will play, and that key members of the engagement board will share their learning from the tabletop exercise that is being run on the 7th of September, which is Monday. So if there's nothing else to add on that, Sally, did you want to come back? I can see you typing.
Thank you. I was just thinking about our earlier conversation around comms messages around schools and the anxiety around schools. It's probably just relevant to mention it on this item.
In terms of getting some comms out around that?
Yes. Sam mentioned earlier in the meeting about the anxieties. I think we were talking about the anxieties of people around young people going back to school. And I think we talked about doing some specific targeted messages related to that, which would seem to make sense to link it to the strategy, the comms strategy.
Yeah. Okay. I've got Councillor Moore, who's the Children and Families portfolio holder. Can you just come in and then I'll go back to Sam and get some assurance over that?
Yeah, I was just going to confirm that would be really helpful. At the moment, we've got sort of like two sort of sides to this. You know, there's the parents who can't wait to get their children back to school because obviously it's been a long time since they last went. And on the other hand, we've got parents who are really, really worried, and they're worried about all sorts of bits and pieces. Schools have, are doing local offers, and some are communicating really, really well. Others are not quite as, good. And it would be really helpful for public health to actually put out some messages to say that, all is well. And also they're worried about what to do just in case there is, a second spike. So that would be really helpful to say that you are, you are aware that there could be one and you are prepared. And it's all about sort of, just the reassurance to help them through this really quite difficult period.
Yeah, can I just add before you come back on that, Sam, around the mask question? A lot of the schools, and I speak as a parent and a governor of schools, are saying that with secondary schools they're very happy. Some are saying they want the children to wear them in public areas. Some are saying that it's up to the children if it helps them feel more comfortable and confident. Which is the position my children's school is taking. But I have also seen some messages, and I don't know if they're local to us or elsewhere, of children actually being turned away from school because they are wearing a mask and their school is saying you can't wear a mask. I'm just wondering whether we need to have that reassurance as well, because I don't see any reason morally why if somebody wants to wear a mask, they should not be denied access to a service because they are trying to protect themselves and others. That feels wrong, and I don't know where that messaging is coming from.
Yes, thank you, Chair. I wasn't aware of that, but that obviously doesn't sit well, does it? Because it's a big change for a lot of people. We know that there will be anxiety about going back to school. We do work very closely with schools. We've worked very closely with schools throughout the pandemic, and as you know, there were a number of schools that remained open. My impression is that actually schools have responded really well to the sort of public health advice and support that we've given them. But I will take it away from today. I'll double check with our comms team what the current messaging that we're putting out is in support of schools reopening. Particularly take that issue offline about the inconsistency and perhaps how schools are tackling the issues of masks, because on the face of it, that doesn't seem helpful and probably won't make people feel great about returning to school. So any insight that you could add to that, if you know where that's coming from, that'd be really, really helpful. We'll try and check it out offline.
Thank you for that, Sam. Okay, so we've got some commitment there to some messaging to go out around schools, as well as the update on the testing. So if I don't have any more requests to speak, so we've got the recommendations there, which, as I've already explained, and that is the final item on this agenda. Our next meeting is in October. Just trying to think, Karen, if you can confirm the date of
the date we currently have in the diary, Chairman, is the 1st of October.
Okay. So we have the 1st of October as the next planned meeting, and all being well, we already have items on that agenda. So I wish you all a good day. Thank everybody for their attendance and attention, and we'll see you all next month. Thank you very much, everybody.
Thank you.